Right now, there is an ingredient sitting in your kitchen that you probably consider harmless. You may sprinkle it, pour it, or mix it into foods every single day. It does not come with a warning label. It is not banned. It is not discussed with the same fear as cholesterol or salt. Yet over the past 2 decades, this single ingredient has quietly fueled a rise in strokes, heart attacks, and heart failure in adults over 50. The disturbing part is not that it exists. The disturbing part is that you have been trained to trust it. It hides in foods marketed as healthy. It appears in products labeled light, natural, whole grain, or low fat. It does not taste extreme. It does not feel dangerous. But inside your body, it repeatedly triggers metabolic stress that your aging arteries cannot tolerate forever. And the damage does not happen loudly. It builds silently day after day until one ordinary moment becomes a medical emergency. Today, I'm going to show you exactly what that ingredient is, why metabolic cardiovascular specialists are increasingly concerned about it, and how you can remove it before it removes your margin for safety. After 50, your cardiovascular system operates with a smaller margin for error. Arteries are less elastic. Blood pressure regulation becomes more sensitive. The ability to recover from sudden vascular stress declines. What your body could compensate for at 30 may overwhelm it at 60. I am Dr. Javier Morales. Over years of working alongside metabolic researchers and cardiovascular endocrine specialists, I have seen how these events unfold. They rarely begin in the emergency room. They begin quietly through repeated daily exposure that gradually weakens arterial stability. Many people who suffer strokes or heart attacks are not reckless. They believe they are eating responsibly. They avoid obvious fast food. They choose products labeled as better choices. Yet hidden within those choices is a consistent metabolic burden that accumulates over time. In the next few minutes, you will understand how this ingredient attacks your cardiovascular system through 7 distinct mechanisms, where it hides in foods you trust, and how to systematically reduce your exposure before the damage becomes irreversible. The ingredient I am referring to is added sugar, not the natural sugar found in whole fruit. Not the small amount that occasionally appears in traditional foods. I am talking about concentrated sugars that are deliberately added to packaged products in forms your metabolism was never designed to process repeatedly at modern levels. The problem is not a single dessert. The problem is constant exposure. Added sugar appears in breakfast cereals, flavored yogurts, protein bars, salads, dressings, bread sauces, and even foods labeled whole grain or low fat. It does not need to taste extremely sweet to create a powerful metabolic reaction inside your body. And that reaction affects your cardiovascular system in multiple ways. The first mechanism is triglyceride elevation. When you consume large amounts of added sugar, especially fructose-based sweeteners, your liver becomes the primary processing center. Fructose is handled differently from other nutrients. When intake exceeds what your body can immediately use for energy, the liver converts that excess into fat. That fat is packaged into particles known as very low density lipoproteins and released into your bloodstream as triglycerides. Elevated triglycerides are not harmless laboratory numbers. They represent circulating fat that contributes to plaque development inside artery walls. Over time, this buildup narrows blood vessels and increases the likelihood of blockage. In adults over 50 whose arteries are already less flexible, high triglyceride levels significantly raise the probability of heart attack and stroke. The second mechanism is suppression of protective cholesterol. High-density lipoprotein plays a critical role in removing excess cholesterol from artery walls and transporting it back to the liver. It acts as part of your vascular cleanup system. Diets high in added sugar are consistently associated with lower levels of this protective cholesterol. When triglycerides rise and protective cholesterol falls simultaneously, the balance shifts toward accumulation. More material is deposited in the arteries while less is removed. Plaque grows, stability decreases, and the conditions for a sudden clot become more likely. None of this produces immediate pain. There is no dramatic signal while the damage is occurring. But each repeated exposure adds another layer of stress to a cardiovascular system that after 50 has less capacity to compensate. The third mechanism involves blood pressure, dysregulation. Most people believe salt is the primary dietary driver of high blood pressure. While sodium does play a role, added sugar affects vascular pressure through different pathways. Frequent sugar spikes trigger repeated insulin release. Elevated insulin influences how the kidneys handle sodium and fluid balance. It also affects the tone of blood vessels, making them more prone to constriction. Over time, this repeated metabolic signaling contributes to sustained elevation in blood pressure. For adults over 50, whose arteries are already less elastic, even modest increases in pressure create additional mechanical stress against artery walls. Higher pressure accelerates plaque growth and increases the likelihood that a vulnerable plaque may rupture. And when rupture occurs, clot formation follows. That clot can block blood flow to the heart or brain within minutes. The fourth mechanism is plaque inflammation and instability. Plaque inside your arteries is not simply a passive buildup of fat. It is a dynamic structure influenced by inflammation. Diets high in added sugar promote systemic inflammatory signaling. Chronic inflammation weakens the fibrous cap that covers arterial plaque. A stable plaque may narrow a vessel slowly over years. An unstable plaque can tear suddenly. When the protective cap ruptures, your body interprets it as injury. It responds by forming a clot to seal the site, but inside a narrowed artery, that clot can completely block circulation. In the heart, this becomes a myocardial infarction. In the brain, it becomes an ischemic stroke. The event appears sudden, but the inflammatory groundwork was laid over years. The fifth mechanism is insulin resistance and metabolic syndrome. Repeated exposure to added sugar forces the pancreas to release insulin again and again. Over time, cells become less responsive to insulin's signal. This condition, known as insulin resistance, leads to elevated blood sugar levels, increased abdominal fat accumulation, and further triglyceride production. Insulin resistance is not just a diabetes risk, it is an independent cardiovascular risk multiplier. It amplifies inflammation, worsens lipid imbalance, and accelerates vascular aging. In individuals over 50, metabolic syndrome dramatically increases the probability of both heart attack and stroke. These mechanisms do not operate in isolation. They reinforce each other. Elevated pressure, rising triglycerides, falling protective cholesterol, chronic inflammation, and insulin resistance combine into a single outcome. A cardiovascular system under constant strain, waiting for the moment it can no longer compensate. The sixth mechanism is endothelial dysfunction. The endothelium is the thin inner lining of your blood vessels. It plays a critical role in regulating circulation. A healthy endothelium produces nitric oxide, a molecule that allows blood vessels to relax and expand properly. This flexibility helps maintain stable blood pressure and smooth blood flow. High intake of added sugar interferes with this process. Repeated glucose and fructose spikes reduce nitric oxide availability and increase oxidative stress within the vessel wall. Over time, the endothelium loses its ability to regulate dilation effectively. Blood vessels become stiffer. Circulation becomes less adaptive. In adults over 50, this matters even more. Aging already reduces endothelial efficiency. When added sugar accelerates this dysfunction, arteries lose their protective flexibility. Stiffer vessels increase pressure load on the heart and heighten the chance that an unstable plaque will rupture under stress. The seventh mechanism is oxidative stress and accelerated arterial aging. Added sugar promotes the formation of advanced glycation end products. These compounds form when sugar molecules attach to proteins in the bloodstream and vessel walls. This process stiffens tissues and damages structural integrity. At the same time, excess sugar increases free radical production, further injuring the arterial lining. The result is premature vascular aging. Arteries behave older than your chronological age. They become thicker, less compliant, and more vulnerable to injury. When arterial aging accelerates, the threshold for a catastrophic event becomes lower. It takes less stress to trigger a crisis. Now, here is what makes this even more concerning. Many of the highest sources of added sugar are foods people choose specifically to protect their hearts. Low-fat fruit yogurt often contains significant amounts of added sugar to compensate for flavor loss. Granola bars and energy bars marketed as clean fuel frequently combine multiple sweeteners in one product. 100% fruit juice delivers concentrated sugar without the fiber that slows absorption. Whole grain breakfast cereals can contain substantial added sugar per serving. Light sauces and dressings often replace fat with sugar. Commercial whole grain bread may include added sugar in every slice. Sports drinks and flavored waters act as liquid sugar unless you are training intensely. Dried fruit mixes concentrate natural sugars and often add more. Flavored plant milks and many protein products marketed for fitness can contain levels of added sugar comparable to dessert. These are not indulgence foods. These are daily habits. And when daily habits repeatedly deliver metabolic stress, the cardiovascular consequences accumulate silently. Now that you understand how added sugar damages your cardiovascular system, the next step is control. The good news is this. Once you learn how to identify added sugar, you immediately reduce your exposure. You do not need a complicated diet. You need awareness and consistency. Start with food labels. Added sugar rarely appears under a single obvious name. Instead, it hides behind multiple terms. Syrups are concentrated sugar sources, especially corn-based syrups and high fructose varieties. Words that end in osa, such as fructose, sucrose, dextrose, and glucose, all represent sugar molecules that trigger metabolic stress. Concentrates and nectars, including fruit juice, concentrates sound natural, but behave like sugar once absorbed. Even terms that appear wholesome, such as cane juice, coconut sugar, or agave nectar, produce similar effects inside your bloodstream. Here is a simple rule. If a packaged product contains multiple forms of sugar within the ingredient list, your cardiovascular system experiences multiple metabolic hits. The longer the ingredient list, the greater the likelihood that added sugar is present. Now let us make this practical. The 4-week sugar exit plan is designed to reduce exposure gradually without overwhelming you. Week 1 is awareness. Do not change anything yet. Simply read labels. Identify where added sugar enters your daily routine. Knowledge creates leverage. Week 2 is liquid elimination. Remove sugary beverages completely. This includes sweetened coffee drinks, fruit juices, sports drinks, and flavored waters with added sugar. Replace them with water, unsweetened tea, black coffee, or sparkling water. This step alone can produce measurable improvements in triglycerides and blood pressure. Week 3 focuses on breakfast and snacks. Choose protein-rich, minimally processed options that stabilize blood sugar rather than spike it. Eggs, plain yogurt without added sugar nuts, seeds, and whole foods reduce insulin surges and metabolic stress. Week 4 is meal quality. Shift toward whole foods with short ingredient lists. If a product contains more than 5 ingredients and includes any form of added sugar, reconsider placing it in your cart. During the first 2 weeks, you may notice cravings, irritability, or mild headaches. This is normal. Sugar stimulates reward pathways in the brain. However, research shows that cravings decline significantly within 1 month of reduced exposure. You do not need perfection. A 90-10 approach works well. Minimize added sugar 90% of the time. Allow flexibility for special occasions without guilt. Your heart does not require added sugar to function. Removing it reduces cumulative stress and increases your margin of safety. Heart attacks and strokes do not begin in a single dramatic moment. They begin quietly inside arteries that have been under pressure for years. As a physician, I want to share something personal with you. Over the course of my career, I have sat with patients and families after life-changing cardiovascular events. I have heard the same sentence repeated many times. I did not know. I thought I was eating healthy. I wish I had understood sooner. That is why I speak directly about added sugar. Not to create fear for the sake of fear, but because I have seen the consequences of long-term metabolic stress. I have seen how small daily habits accumulate into outcomes that feel sudden but were building silently. Now, I want to be very clear. This information is educational. It is not a substitute for individualized medical advice. Every person has unique risk factors, medical history, and medications that require professional evaluation. If you have existing heart disease, diabetes, or any chronic condition, you should consult your healthcare provider before making significant dietary changes. But education empowers better conversations with your doctor, and awareness changes behavior. After 50, your cardiovascular system deserves intentional care. You cannot control every variable in life. Genetics play a role, aging plays a role, but exposure is something you can influence. Reducing added sugar is not about perfection. It is about lowering cumulative stress on arteries that are already working hard. It is about increasing your margin of safety. If this message resonated with you, start today. Read labels, remove the hidden sources, protect your heart before it forces you to pay attention. And if you know someone over 50 who believes they are eating responsibly, share this with them. Sometimes prevention begins with a conversation. I am Dr. Javier Morales. Thank you for taking your cardiovascular health seriously. Your future depends on the habits you choose now.